Thank you so much for joining us. My name is Nico Murillo, and I am the chair of Texans for Safe Access. I'm here today with two of our nurse board members, Christy Zartler and Sherry Maddox, and today we are here to talk about one of our most favorite things, patients. So, so thank you so much for joining us. I really wanted to talk to the nurses today because we're coming up on Giving Tuesday, and we really need y'all's help to bring more patient testimonials to the public. And so if you go to our website, you'll see that patient testimonials are at the core of our chapter. And we believe that those testimonials are what make the most impact at the capital level. So we want you to check that out. Definitely go to our website. You'll see that we have about 6 of those up. We want to do more. And it costs about $100 to make a patient video like that. Christy, you did one of those with Mark, and you can see that on YouTube, their video about Kara. But we want to do more. We want to create 24 videos for the 2021 session, and we need your help to do that. So I wanted to talk a little bit about patients, and I thought y'all would be perfect to talk about it because many people don't know that patients live on fixed incomes. And in order for us to really get those testimonials out to the public, we need to get more testimonies out. So can we talk a little bit about what patients look like that live on fixed incomes and what kind of challenges they have in getting down to the Capitol to advocate with us?
Well, definitely they have to plan everything. Everything is budgeted, so it's really difficult for them to add anything in, especially something that's that big of an expense, traveling out of city, or
the food and accommodations, the hotel, or many times even the caretaker, having a caretaker that can watch the patient while, the caretaker while they're going to the Capitol. They'll have to oftentimes have somebody to stay behind to take care of the patient while they're able to advocate at the Capitol level. And so that's what you and Mark have done, and you certainly know that there's cost associated with advocating and taking your testimonial down to the Capitol level.
Well, as a parent, and because I provide all the daily care for my daughter, I have to have somebody that I trust to do the bathing, the dressing, the feeding, and giving medications to my daughter while I'm gone, while my husband and I are both away. So that it takes lots of planning and lots of trust, and it's very difficult for families like mine.
And do all families like yours have the opportunity to pay for someone to watch?
No, not every family. Most parents in my boat, they probably can't even make it to the Capitol unless they bring their child.
Yeah, absolutely. And some of those costs would include, the actual travel to the Capitol, the gas that's associated with it, as well as the food throughout. And then many times, you have to stay the night, right? Those costs can get up to, $500,
Sure,
give or take, each time you're going down. And so it really limits the amount of stories that we can get out and the amount of patients that can go up to the Capitol, because many patients just can't afford those costs. So that's where an organization like ours comes into place, of really highlighting patient challenges and bringing those stories to y'all, so y'all can also come and help us in getting those testimonials out. So I just want to encourage you to go to our website, to donate to our cause, to view the patient testimonials, and to understand that all patients that are trying to advocate for this plant medicine also are paying those costs out of pocket, and it's up to us as a community to come together and try to help make that bridge so we can get more testimonials to the Capitol level. So I want to thank both Sherry and Christy for being part of our medical board, and also bringing more stories and education to the public about the challenges of patients. And I want to thank you all for being part of our community. And please consider donating this season to our chapter. Thank you so much.
also please come to our meeting, our public meeting.
Our first meeting will be January the 4th at 1 p.m. at the Meadows Conference Center. And you can look on our event page. You'll see those event details. We would love to have you. And if you are a patient,
we'd love to see you there.
Absolutely. And if you're a patient that wants to share your story, contact us. We are busy trying to get lined up new patient testimonials to share for the new session. So thank you again so much, and happy holidays.
Happy holidays.